It was a blessing for this organization to start all of those many years ago, 25 years ago, in order for us to begin helping those children through volunteerism.
It's a magical program. It happened with just such a stroke of imagination and responding to an incredible need.
I just had this feeling that there was a power much greater than all of us put together that was at work.
It is done creatively and collaboratively and cost-effectively, and really is a model that so many communities can duplicate successfully.
Since the very beginning of Young and Healthy, we've always really tried to be responsive to the community's need and to pay attention to what needs weren't being met in the community. So we began with providing medical care for children who otherwise couldn't access it. But then we added dental and mental health services. And more recently, we've gotten involved with the Affordable Care Act. This was a wonderful thing. Families who could never get insurance before suddenly could get it.
Ana Rojas is a 7-year-old girl. The original referral came from CHAP Clinic, which is one of our partners in the community. She had a physical, and it turns out that she's had a history of enlarged tonsils and also sore throats for a very long time. She was referred to Young and Healthy because we needed to assist her with an ENT. We contacted Dr. Williams' office, and she was initially seen for an evaluation. About a week and a half later, she went back, and that's when he decided that she needed to have surgery. In less than 2 weeks later, we had set up the surgery. The hospital had been set up. The anesthesiologist had been set up and willing to donate. So in less than a month, this child from the initial referral had her surgery.
Okay, going up. Specifically for her, it was airway obstruction. In some of the patients, we have tonsils and adenoids that are large enough that they're blocking the airway. When your airway is blocked, you tend to have decrease in your oxygenation. As you obstruct, the body recognizes it as a life-threatening event. So it triggers the release of chemicals from the adrenal, what we call catecholamines. Those are the stress chemicals. So the body responds to that by increasing heart rate, increasing blood pressure, heart beats more forcefully. And for those people that have this type of obstruction, they may be going through that type of event multiple times a night. And we're usually trying to correct that.
She never really talked that much. And when she came back to do the cards, the thank you cards, she was really excited and she was laughing and she was talking to me. And I asked her, I said, so how do you feel now? And she's like, I am so happy that my throat doesn't hurt anymore.
I'm very pleased with the way her throat looks.
It did a lot of good for her, and a lot of changes have happened since the surgery.
Ana, you've been a good patient.
Thank you.
Just because you have insurance doesn't mean that it always works. And so a large part of what Young and Healthy has been doing more recently is helping families use the insurance once they get it. Not only do they need to understand how to use insurance, but sometimes the system just doesn't work. It has nothing to do with the family. It has to do with the system, and the system isn't all that user-friendly. And so much of what we do is remove those barriers, help untangle the bureaucratic red tape that is involved in these new insurance plans so that a family can actually use them and take their child to a doctor.
You feel very vulnerable because of the way this system is in place. It's this giant quagmire of information and guidelines, and I think that for somebody who's even less experienced in having insurance or dealing with the medical institutions and how best to get things resolved, it can become very overwhelming.
Our work continues in all of those areas. We still want to break down barriers for families and get them the insurance that they need for their children. And we're not going to stop that, not until every last child has access to the medical and dental and mental health care that they need. But there's new avenues to helping families now. There's some groundbreaking research that indicates that early toxic stress in children can very negatively affect their long-term health care. Kids who have very high ACE scores, stands for Adverse Childhood Experiences, are twice as likely to develop heart disease or cancer in adulthood. Children who are aggressive or children who are terrified, sometimes at the same moment. These are children that teachers worry about. So our new work in Young and Healthy is to bring this new research to the people who can help those children the most, the teachers. And we're going to train them, we're going to teach them about adverse childhood experiences, about toxic stress, and then how they, as the adults in these children's lives, can make a real difference.
There's so many children without health care, and so many children that have parents that just don't have the idea of what to do when a child gets sick or has a medical problem. And so when I heard about Young and Healthy, I thought, well, wow, this is just such an incredible idea, and it works really well.
My message about Young and Healthy could be manyfold, but the emphasis that keeps coming to me is the incredible gift that has been given to this community by the medical people, the dentists, the psychotherapists, the pharmacists, and all the volunteers who help the organization.